This is how helicopters arrive at the Hospital for Sick Kids in Toronto, carrying children in need of urgent medical care. And this is the first test landing on a new hospital helipad at the Health Sciences Centre in Winnipeg. There's also a helipad here, right next to the Health Sciences Centre in St. John's. Military search and rescue helicopters can land here, but the helicopters on contract to do medevacs for the province can't. Single engine, not approved by Transport Canada for this site. Instead, they touch down here, near the airport. The patient is transferred from the helicopter to an ambulance for the drive to the hospital, about 7 kilometers away by road. This report from 2015 flagged that helipad issue at the Health Sciences, but nothing has changed since.
All these kind of extra kits we have sort of at our fingertips if we need them in an emergency.
Different province, different story. A couple of years ago, after Transport Canada tightened up regulations, medevac helicopters couldn't land at hospitals in Halifax. So the Nova Scotia government decided to pay for new ones that could. Internal Eastern Health emails from over a year ago reveal more about the limitations of the helicopters used for medevacs here. Written by the former director in charge of paramedicine and medical transport. He's since left for a job in the U.S. Corey Banks called those helicopters the major Achilles heel in air ambulance. Not being able to fly in weather and darkness meant the maximum reliability of the contracted helicopters was 20%. And recent stats show that for every 1 helicopter flight we conduct, we are requested 4 additional times that we can't respond. The Minister of Health isn't talking about any of this. His officials steered our calls to the Transportation Department. No interview there either. But in an email, officials said landing at nearby helipads is a common practice at other hospitals in the country. Rob Antle, CBC News, St. John's.